The health sector has been plagued by myriads of challenges, from infrastructure to equipment to personnel, and the real elephant in the room, real financing or financial investment in it. Many who are seen as well-to-do prefer to seek medical care outside of the country because they think that there are better resources there, and when push comes to shove, perhaps emergency situations, the systems in Ghana may not be able to take care of them. Governments have come and gone, and many have come with various policies to try to improve the system. But it seems those policies have fallen short of what is actually needed to transform the health sector. So with President Mahama bringing in the MahamaCares initiative, the question is whether or not this is one of the policies that will come and go, or one that would put Ghana a step forward and help us be on the path that we need to be on. Hello, good evening, and welcome to Agenda. My name is Beatrice Edu, and tonight we're going to delve into this MahamaCares initiative that is supposed to be helping our health system and change the narratives, perhaps. I do have on the panel with me Dr. Sebastian Sandare. He's the Vice Chair of Parliament Health Committee. Good evening to you, Doc. Thank you for joining us on Agenda tonight.
It's my pleasure.
I also do have with us Dr. Labra Musa. He's the National Coordinator of the Ghana Non-Communicable Diseases Alliance. Doc, it's great to have you as well. Good evening to you.
Evening.
I do have our video call with us, Dr. David Tinkwan Chum. He is the General Secretary of the Ghana Registered Nurses and Midwives Association. He joins us via video call. Doc, if you can hear us, thank you. Good evening. Thank you for joining us.
Good evening, and good evening to you and your listeners and your viewers as well.
Of course, last but not the least, I have Dr. Evans Otieku. He's health economist, University of Ghana. He also joins us by video call as well. Doc, thank you for joining us, and good evening to you.
Good evening, and good evening to your teaming listeners.
Great. I want to start with you, Dr. Sandare. You're the Vice Chair of Parliament Select Committee, like I just said. And I do know that the House passed the Ghana Medical Trust Fund, or what we normally call the MahamaCares, exactly a week ago. I want to find out from you, what are the components of this fund or trust fund, aside from the fact that it's going to take care of chronic diseases that are not currently covered by the NHIS, and of course, if you read through as well, dealing with a bit of infrastructure?
Yeah, thank you very much, and I say good evening to all viewers, especially my constituents, the good people of Dafiama, Busie is a constituency, who are, watching me live. Thank you very much. I will take it from the genesis of it. I mean, we all know that the medical, trust fund bill is a result of a bold, campaign promise by the NDC, by His Excellency John Dramani Mahama, who understands the healthcare needs or the health problems of this country. So the bold promise was made that when he wins power, one of the very initiatives he would take to address the healthcare needs of the people of this country, especially non-communicable diseases, would be to establish a trust fund, now called the Medical, Trust Fund, which will address, issues of non-communicable disease, the complications of those issues that are beyond the reach of the National Health Insurance. Because before this bill, we've all been witnesses to issues of people with chronic kidney failures who do not have the means to access dialysis and other medications of specialized care, and other cancers, diabetes, and so on. So thank God, as we speak, the bill was passed somewhere, I think, the 22nd of this month, by Parliament, which, I mean, is good news for all of us. And you know, the bill is nicknamed, or the whole trust fund is nicknamed MahamaCares, just to show the passion and the love that Mahama has for the people of this country, especially those who suffer from these chronic diseases.
So the question of the components, because I know the bill passed through the Health Committee, which you are vice chair of.
That's
if you can tell us beyond what we know about covering the chronic diseases not currently covered by the NHIS, infrastructure, among others.
I mean, basically, the bill has, or the building blocks of it, you know, has the objective. I mean, what is the whole bill or this trust fund about? And basically, you know, the object is to mobilize money and resources that will take care of these people with chronic, non-communicable diseases like I have mentioned. Yes, of course, as a trust fund, definitely the structure, you know, will look at where would the funding sources come to. Then it has as part of the structure, a board that will oversee, you know, how the fund is managed. And then, of course, what will be the criteria or the, you know, qualification for the use of the resources that will mobilize. So if you take the bill, I mean, and you look at the structure, basically, you'll find these as the building blocks of the bill.
So let me ask you this quickly, and I'll take the view of other panel members as well. You talked about mobilizing funds. Why use 20% of NHIS funds to support this new initiative when you're very much aware that the NHIS itself needs help?
20% because we have to start the fund, and one of the sources is the 20% of the National Health Insurance Fund, but that is not the only sources. I mean, the only source, but there are other sources. And you ask why the 20%? Because we need money that will start the fund, because it's not going to be a talk show. I mean, Mahama didn't want to make a pledge that Ghanaians will say, oh, he made a pledge and didn't start the fund.
So, Doc, the question I asked is, NHIS is currently struggling. And I know as at April, private health facilities were even complaining that they suspended services because they said they had not received their claims. So I'm saying, fine, you need the funds to start this whole initiative. Yeah. But why take it from a place that is already struggling? And if you could answer that in just a few seconds so I can get to the immediate...
I mean, rightly so. As we speak, I mean, Ghanaians and service providers will testify that health insurance is not struggling as it used to struggle.
It used to struggle. I'll come back to you, Doc.
If I may finish, because you realize that His Excellency John Dramani Mahama uncapped the National Health Insurance Fund. It used to be capped, and monies for that, we didn't know where the money went to. It has been uncapped by His Excellency John Dramani Mahama, bringing more resources to the National Health Insurance. So as we speak, the fund cannot be said to be struggling because we know payments have been regular. And if we just listen to the finance minister, you know, you realize that funding is no more a challenge as it used to be, and payments have become regular, and service providers will testify to that.
I will come back to you. I want to come to you, Dr. Tinkranchum. In a speech during the launch of the initiative, President Mahama said that this is a part of, and I quote him here, his administration's broader agenda to build a resilient and inclusive health system. Do you see this way? and also having heard the initial comments of Dr. Sandari. Hello, Dr. Tinkranchum, can you hear me?
Yes, please, I can hear you.
Excellent. I hope you heard the question.
Absolutely, I heard everything I said. Sorry, I had not unmuted. All right, so good evening to you and the great minds you have in the studio and those on the call. And good evening to Ghanaians as well. I've listened to my good friend and colleague, and I think that he's spot on. You see, I think that most of the challenges that we have when it comes to health financing in Ghana can be drawn down to two major things. One, political will, and financing, okay, in terms of source of financing. So if you look at how the health insurance was established in 2003 by Act 650, it sought to prevent vulnerable people, or if like Ghanaians, from out-of-pocket payments, which sort of prevented quite a number of our citizens from accessing decent and regulated healthcare. So any initiative that seeks to augment or enhance access to finance must be embraced. What I will want to watch closely as to whether this is going to create a parallel structure that is only going to create a certain bureaucratic process that siphons the non-existent finances. Already you were talking about national health insurance struggling, and Dr. made reference to the fact that it has been uncapped. Previously, when it was capped, it tells you that not all the monies that were realized, which was intended for national health insurance, went to national health insurance. I was of the humble opinion that if we have uncapped it, then we should direct 100% of its entirety to national health insurance so that they can pay their obligations, and then also review the national health insurance such that misapplication of funds can be something that could be dealt with. However, in the wisdom of the president and his charges, they are of the view that we should use 20% as perhaps a startup fund, whilst they look at other sources of financing, I mean, from corporate Ghana and all that, which is laudable. We'll be watching closely as implementers of same, and to make sure that we support it so that it succeeds. Don't forget that every president has a social contract with the citizens, and based on that, they are voted to office. All what we need to do is to support them to succeed. All right, but if there are any challenges, as we observe from afar as technocrats, we'll bring it to their attention.
Indeed, and you did say that one of the main...
Just to end, I felt that we could have... Coming in?
Please go ahead.
I felt that we could have looked at other sources. So, for instance, one of the things that the health insurance, the new intervention is seeking to bring on board is to take care of NCDs, all right, non-communicable disease. And we know how galamsey is impacting adversely on our water bodies and its repercussions on kidney diseases. I felt that now that we have established a gold board, okay, if we have been consulted as necessary midwife, we would have suggested that at least a certain dedicated fund, maybe 1%, 2% of monies that are realized from gold should be dedicated to this fund, so that it could help mitigate the bad impact of galamsey, if you like, of gold mining on the citizens of Ghana. But that said, we are ready to support the intervention. I think that this is not the first time we are having such intervention from government. I mean, I remember in 2004, President Kufuor had to bring some similar intervention that sought to take care of children under 5 and perinatal mothers, pregnant women, and all that. And we saw how it's helped the healthcare delivery. So let me end for now, and I'll come back again.
Yes, you say you support it, and I was going to ask you earlier about the point you made, which is that one of the main challenges we've had is financing. How does this initiative, for instance, address the numerous challenges within your sector, where you've even had some of your experienced members leaving the country for greener pastures elsewhere, resources, equipment, and a few others? How do you see this initiative addressing these challenges?
If corporate Ghana decide to support this intervention by the president by donating generously to the fund, and also, as I made mention, if we also try to innovate, to look at other funding sources to improve upon the funding, it will go a long way to, because they made mention of the fact that they want to even buy logistics. And don't forget that it's not only remuneration that is driving people out of the country. If we don't have the logistics, if you don't have the equipment to work with, certainly it will be demotivating and people will leave. So if the funding is coming to help, buy logistics, buy equipment that can enhance our practice, I believe that it will mitigate the effect to a lesser extent. And as I said, we need to apply these funds judiciously, okay? And we need to avoid bureaucratic tendencies that will only erode the gains that will be made from the generous donations that people will make. But I think that if Ghanaians embrace this concept, and we all, try as much as possible, corporate Ghana try to, on regular basis, dedicate a certain amount of their dividends as corporate social corporate responsibility. I believe that we can sustain this thing. And what I want to humbly say is that we need to de-emphasize politics on this matter. That is why sometimes when you bring up policies like this, it must have a certain catchy phrase and stuff like that. But if we personalize it, then it becomes very difficult for subsequent government to push it. But I believe that when the bill was being passed, the mind of the government was brought to that, and I'm very happy that they were very amenable to that kind of conversation, so that we can sustain it, so that it doesn't become coterminous with the term of Mr. Mahama.
Indeed. I'll come back to you, Dr. Tinkranchum. I want to come to you now, Dr. Musa, because I believe this is good news for you.
Yes, indeed. We actually received this information with a lot of, excitement, happiness. In fact, let me say that even when the announcement was made during the campaign, we're also monitoring, what the various political parties are saying with respect to, how to address, the challenges and difficulties people living in non-communicable diseases are facing in this country. So we're very much excited when, we got to hear that the current president, is interested in the cause of people living in cities, and the fact that he made a bold statement, to come up with a fund, to support, the troubles that people living with non-communicable disease in Ghana are going through on a daily basis, especially the fact that, the National Insurance was unable, to address the major challenges that we face. Indeed, you and I know that when you talk about non-communicable diseases, these are very expensive, to treat kind of diseases. So we're happy when the president made that call, and indeed, when he assumed the office, he didn't relent. He translated in the promise into action, and that also was something that we also felt that was commendable. We issued a statement when the launching was done. To commend the president and the effort that he has put in, and the remarkable statement that he made on the day. The fact that he himself is a person who lived with non-communicable diseases. And when we say live non-communicable diseases, it's not necessarily you having the disease. But
Doc, I want you to hold on. I'll come back to you. I want to get the quick thoughts of our economist, Dr. Evans Otieku. Doc, if you can hear me, the question I want to ask you is really how stable financially this is. When you have like I just said, we've seen how the NHIS has been. Well, we've had Dr. Sandari dismissing that claim that, yes, NHIS used to have a problem, but we don't have those challenges now. From where you sit as a health economist, how financially stable is this initiative moving forward?
Yes, so thank you so much for the opportunity to engage me on this issue of financing our healthcare. Generally, I start by looking at the broader context of this whole bill that is in front of us. And the more I look at it, the more questions I have than commendation. But it is all for the good of the country to have such a bill. One, it signals that there is more attention on health, as my senior members have already iterated. It seems to be something that is very catchy to our president to pay more attention to financing our healthcare needs of the population. It also, for me, suggests that there is also some deliberate attempt to sort of increase funding for our healthcare system. As you know, without money, is basically the lifeblood of the health system. But way back, more than 20 years down the line, from Abuja Declaration to when NHIS became took effect, that is 2003. Up to now, you look at our health financing, our healthcare expenditure per capita. You look at our healthcare budgets as a percentage of total government expenditure. Consistently over the past 10 years, we have done less than 8%. Compared to, if you look at the North African countries, most of them were living up to the Abuja Declaration of 15%. So somehow I say that this bill has come to augment the financing of our healthcare systems. But the question that you have asked, which is also one of the questions on my mind, is the sustainability. Indeed, if you look at how our NHIS is being financed, basically from 6 streams, right? So you look at 2.5% NHI levy, look at 2.5% SNIT, you look at direct government allocation, that is budgetary allocation from fiscal point of view. You look at grants, donor support. You also look at accruals from investment. So basically these streams, when I read this current bill, it seemed to me that it picks from how the NHIS is being funded to sort of try to say that, okay, this is how it's being funded, but this is how, again, we are going to fund this. And there is some cutting of these measures. So, for example, the grants that goes to fund NHIS, okay, and now we are saying that we also expect, beside the 20% of the NHIS funding, we expect some grants to go to fund this MahamaCares that we've been asked not to say MahamaCare because we are looking at long term, beyond Mahama's tenure. It goes beyond that, how to sustain it. So that baffles me a bit. Of course, as I have mentioned, we have sort of tried to increase the allocation. If you look at last year, for example, we did some close to 6 billion, 6 billion Ghana cedis. And this year we are doing, I think Parliament has approved some 10.7 billion, right?
Yes.
So 20% of that, if this bill takes effect, 20% of that goes to fund this. So what that simply means is that there is a cutback of what is going to fund the NHIS. But is this a sustainable way of doing it, which is the key question, okay? Looking into the future more broadly, I see there are several things that we can do, like the proposals that my senior colleague just mentioned about some revenue being seeded aside from good revenues and so on and so forth. But we need to look at it more carefully. One, we have a challenge basically of how we mobilize funding. because generally, if you look across Africa, the issue has been whether to choose between tax-based system, which we call the beverage model of health finance, or to go along a mixed approach, that is the beverage and then the Bismarck model. The Bismarck model, which is more of employment-based financing. Okay. In Ghana, we have a bit of everything at play, but our problem has been how to rake in more revenue from the premium side. And also, if you look at the support we get from SNET contribution, how we can rake in more also from the informal sector. I know that there are steps, there are processes ongoing to sort of try to rake in some revenue from the informal sector.
So, Doc, I want you to answer the question a bit more directly for me. I know you said that you have more questions than commendation. That was your opening statement. And you talk about or admitting the fact that we have financial challenges. What gaps do you see, which is why you made that statement that you have more questions than commendations? If you could answer those specifically for me.
Yes, so briefly, trying to digest the bill, I asked myself, for example, yes, it's good. The focus being on NCD is good. But the rationale that 45% of our mortality burden is attributable to NCD. Of course, that also means that if you look at it from the prioritization point of view, what is causing more harm is what we prioritize. So 55% of this mortality burden is basically driven by communicable diseases. And if you look at from 2017 to 2021, right, the top 10 OPD cases that are recorded nationally, okay, 7 out of the 10 are mostly communicable diseases, right? And the fact also that we tend to focus more on curative care than preventive care also sort of baffles me a bit. NCD is something that you can manage, but it's not curable. Okay, so why not invest money? For example, what we are investing now into this program, maybe just about 10% of it can do a whole health promotion campaign, okay, to mitigate or address or prevent, the incidence of NCDs, right? So these are some of the reasons I ask myself. I keep wondering whether, we are charting the right path. But on a more broader footing, I also see that, well, if we are able to find a way of sustaining it financially, then hooray, thumbs up. It is a brilliant move to say that, well, it is one way of committing more resources into health, so that at least we are able to increase our healthcare spending per capita. We are also able to put more smile on people's faces. But another question on my mind is if this bill is able to address what we now call effective service coverage, which is more about the timeliness of the care. When people need it, will they be able to access it more timely? And
I believe
also need to be taken care of. Beside the idea of having, a fund to cater for the care of these patients.
Indeed, Doc, I'll come back. I'm sorry, Doc. I'll have to come back to you. You talk about effective service coverage. I believe that's something Dr. Tinkrine Chum can answer. But I want to come back to you, Dr. Musa. You were making a point earlier when I interrupted and went to him.
Right. So the name is Labran Musa.
Yes.
Yes. Yet to get the title and doctor. Right. So the point that I agree with the point that he made in terms of some of the issues that he spoke about. Indeed, one of the issues that we actually also having has to do with the fact that the issue about health promotion, which practically missing in the Ghana Medical Trust Fund. But I think there were some explanation that were given the fact that government is currently also working around the free primary health care, which will have a component of, scaling up, health promotional activities, to reduce, so once the MahamaCare is there to support the creative aspect, we'll have aspect that will, dealing, strategically on health promotion across the country. I know, I mean, some discussions are ongoing on that, though we are yet to be consulted on that to see how we can contribute our quota. But of course, in terms of sustaining it, if as people live with non-communicable disease, we also feel that sustaining the MahamaCare is something that we're also very much interested in. Now, and it has come up, I mean, practically many times. One of the things that we were not so much happy about is the funding source. And the fact that the source, I mean, is too open, you know, to the extent that when we talk about corporate Ghana, just as one of the panelists mentioned, corporate Ghana means anybody at all can contribute into the fund. But we are talking about non-communicable diseases, and these diseases are driven by certain activities, by commercial actors. You know, so we were of the view that if there is some kind of limitation or measure to reduce the extent of, you know, industry involvement or industry influence in the adequate in investing into the fund, that will be more appropriate because I mean globally, I mean industries are being commercial actors who are fueling the kind of problem that we are having currently. I mean their activities are being kind of tamed or reduced to a large extent just so they don't continue to fuel the problem that we're having. And the solution for us is the fact that why don't we look at, taxing on healthy commodities? Of course, let me say that Ghana in 2023, there were some taxes, and thanks to our members of parliament.
You mean cigarettes, alcohol, and the rest?
Tobacco, alcohol, sugar, and sweetened beverages, taxes have been put on them. And we are told that Ghana is currently generating huge amount of revenue. And one of the proposals we're making is that why, can't Ghana, the government also look at earmarking at least a percentage of that huge amount of money that the GRA is currently realizing from they said that would be more sustainable, and to add on to the other funding that's coming. For us, the 20% that is being allocated, we have no problem with it because indeed it's going to reduce the burden. In fact, for far too long, people living with chronic conditions, have been left on their own, and families are struggling. The mortality is increasing on a daily basis. In fact, the 45% that we are seeing, I think that it's even more than that, and the fact that currently, if you look at the number of cases that go to the hospital on a daily basis, in fact, it is rising. And if you're not very careful, it will overtake communicable diseases. So the point is that there are many things that we can do. That's why I agree with him on the issue about health promotion. It is very, very critical and very, very important that government needs to roll out a lot of, a lot of promotional activities, including screening, including awareness creation on these, the effect of consuming these harm commodities. Because the more we consume them, the more our disease burden, increases. The more our disease burden increases. I'll come back to you, and I would come back as well to you very quickly, Dr. Sandare, but I want to get the quick response of Dr. David Tinkwan-Chum. I'm sure you heard Dr. Oteku there mention that, yes, we can get the financing, but we also need the workers in that sector to meet the standard, as it were, and he used the expression of effective service coverage. How do you see your members fulfilling this bit as the financial burden bit is also tackled by the government?
All right, thank you very much. I think I agree with largely what he said. What is important, and as I've told you, is that as technocrats, we will ready ourselves because we are going to implement the whole policy initiative, right? And like the health promotion bit that we're talking about, I believe that when it gets to the modalities of implementation, all those aspects could be factored into consideration. Because you cannot just jump and start treating stroke patients when you are not tackling the main causes of sin. All right. So I believe that when it gets to the implementation, we will look at that. But as carers or as service delivery officers, as frontline officers, we are very much ready to support the initiative. I have said that it's a very good initiative. What my problem was the funding, and once we're able to figure that one out, I think that we need to support it, because you see, we take care of these individuals, all right, and you even find some nurses and midwives also having similar conditions, all right, which falls outside the remit of health insurance, and sometimes it falls on the associations and it falls on even individual nurses contributing to support the care of our people. And our recent conversation that we had with government, we spoke about Medicare cover, and it dovetails into all these arrangements. So that's why when Mr. Mahama launched the thing, my association donated 150,000 Ghana cedis in support of it. We know the nuances of same, and we think that if we are able to support it as a people, as Ghanaians, it will inure to the benefits of the total citizenry of Ghana. So I think that to a large extent, I can tell you that nurses and midwives, and for that matter, all other health workers, will collaborate effectively to help in the rolling out of these interventions. And as I've said, this is not the first time a president is bringing out such intervention. And once we know that it will help the system and it will make the health delivery system more robust, we will be more than ready to support it. Just that, as I said, we will observe how the funds are used, because we can cite instances where some of the health insurance levies were misapplied. Right? I'm not saying that they were misappropriated, but they were misapplied. For instance, if you start building school blocks with health insurance levies when you have not fulfilled your obligations to your creditors, or service providers, then you are not prioritizing the disbursement appropriately. So we watch it, and we offer brilliant, humble suggestions as time wears on.
As time goes on, I'm coming back to you, Dr. Sandarian. Earlier, I talked about the financial history of our health system, and I remember clearly your response as well. And I just want to give you some data, really, because there are reports that in 2008 alone, the government through the NHIA owed service providers some 456 million cedis. In 2014, NHIS accumulated claims were about 998 million cedis. And earlier, I talked about the April bit where private health facilities suspended NHIS services over delayed or non-payment. What would you say to critics who would argue that instead of strengthening the NHIS and giving it all the support or resources needed, why bring in a new initiative?
Yeah, thank you very much. And I thank my colleague panel members. You realize that for this particular intervention, we are all happy with it and think that it's a good initiative that all Ghanaians must support it to be sustainable. And what I also want to clarify, you see, we shouldn't see that the Ghana Medical Trust Fund is coming, to kind of be parallel or collapse national health insurance. No, it's rather coming to complement the national health insurance. And that is why His Excellency John Dramani Mahama, I see him as a health expert. See, he's bringing two bold interventions. Free primary health care, which is at the basic level that health insurance, focuses more on. And then the medical trust fund focus on the extreme where those are conditions that specialists must deal with. So once you deal with primary health care, it means you are reducing the burden of these chronic diseases. One, you reduce the incidence, and once you reduce the incidence, you are reducing the burden of people living with these conditions. So once, let's say it's a pot of chronic diseases, and you're able to prevent more diseases from entering that chamber, that pot, it means even by design, the Ghana Medical Trust Fund will be sustainable. Because once primary health care is working, the disease burden will reduce, and NHIS will be able to contain that and then leave the specialized, complicated cases for the trust fund, the Ghana Medical Trust Fund, to handle. So my focus or appeal, if all of us want the Ghana Medical Trust Fund to be sustainable, then we should all focus on how we support Mahama's intervention of free primary health care. And this one is at the community level. That is not just about health workers, but what it means is that we're going to look at our lifestyles, look at hygiene, look at nutrition, look at the water we drink. So what it means is that we have to take the policy, what is called health in all policy, very seriously. Meaning that whatever policy that we are taking as a country, you must look at health in it. This morning, just to digress a bit, I was listening to news where in one of the communities, a pregnant woman or women go to a particular chief's compound to deliver, and they don't have water to bath. You ask yourself, why should a chief's compound be built without a borehole or without toilet? That cannot go on.
Shouldn't the Ghana Health Service be responding to this?
No, not the Ghana Health Service.
Or the local assembly?
That should be the local assembly and anybody that is funding the construction of, say, a chief's compound or building a school. And I think this one, His Excellency John Dramani Mahama has come out clearly that henceforth, no district assembly or no government facility should build a chief's compound without, let's say, water facility, without toilet, and those interventions. Just to stress that for primary health care to work, all of us have a role to play there and make it work. And once it works, it means we'll be reducing, disease burden, and national health insurance will be sustainable. Ghana Medical Trust Fund would also be sustainable. So the Ghana Medical Trust Fund is just coming to complement, what NHIA is doing. And let me add by saying that, you see, when NHIS was capped, the fund was capped, the monies that government was collecting, till date, it couldn't be accounted for. The Ghana Medical Trust Fund, the money, the 20% that is being taken from the NHIH fund is being retained.
So the point you're
in the health sector. So it's not money that is coming to be used for other things, but it's still coming to be used in the health sector. So
the point you're making is that although 20% of NHIS money is being taken to support the MahamaCare, it is not in any way going to affect the NHIS in its full operation as we speak.
Yes, this is managed very well. And we all agree that it should be a fund that should be managed very well. No mismanagement, no abuse. The fund should be used for the intended purpose. That way, it will be sustainable.
I want to come to you, Dr. Tieku. I know earlier you were talking about challenges. I want to hear from you your own solutions. What recommendations do you have as regards making this work and ensuring that our health system is robust?
So, great. Basically, when you have a program like this, for it to be sustainable, you would expect that your funding stream should primarily be domestic. Domestic because now we understand from the health financing landscape that there is some sort of donor fatigue in the system, right? Way down from after COVID-19, now countries are beginning to look inward, bilateral, multilateral donors and grantees, grantors are looking inward. So to keep the fund, to keep the trust fund on a rolling basis, okay, more sustainably, you would expect that we are able to support it from internally generated revenue, domestic revenue, right? So that the funding streams, as mentioned in the bill, to include grants, should be something that should be looked at as a windfall. As and when it comes, fine. But the question also is that how much are we looking to spend in total annually? Okay, are we looking at pegging it 30-40% of what we allocate for NHIS, such that if we are getting 20% from NHIS allocation to this fund, we can be able to raise the remaining from our own domestic resource mobilization. So these are, some of the things that we need to carefully look at. If you look at, for example, our reliance on donor funds, so I tend to look at it, give this example, right? So just 2024 thereabout, just before USAID was scrapped, right? They have entered into partnership with government of Ghana to support our health system with some close to about $24 million thereabout, right? That has been scrapped, okay, just by way of the demise of USA. Okay, that is just to say that sometimes grants cannot be reliable, right? So we need to have a more domestic way of raising this money.
And
okay,
if you could be wrapping up for me, Doc,
right?
if you could be wrapping up for me.
Yes, so going forward, the proposal is that we look at funding stream mainly from domestic sources, rather than from donor funding or grants from elsewhere. Otherwise, we are not able to keep up with the demand, right?
Indeed, otherwise we'll not be able to keep up with the demand. And I'm going to come to you very shortly, Mr. Labram Musa, but I want to read some of your comments back to you. And I do have Peter Agleke. Okay, I'll go to Sebastian, who says this is the first time in about 8 years that NHIS has cleared all claims across the country. This is commendable. Also, Nelson says, watching you live from Lambusier, great one. That's referring to the Member of Parliament, Honourable in studio here. Also, there is as well Hassan. Okay, I will rather go to Fatau, who says, good evening. I'm watching you from Tingoli, TV3. You do all. And then I'll read this one before I come to you, Doc. It says, am I the only one who heard the General Secretary of the GRNMA, Mr. Tinkwan, refer to the President of the Republic? Okay. I'll move to the last message here before I come to you. And this is talking about some 1.2 billion, or is it million cities? That's okay. So Sebastian says, and that's, I guess, to Dr. Sandari here. Sebastian says in April 2017, Nanado, Dr. Baumia government cleared 1.2 billion Ghana cedis of all claims to health care providers. These are some of your messages. Hopefully I'm able to read more to you, but I'm coming back to you, Mr. Labram Musa, and looking forward to recommendations and solutions beyond what you've already said.
Right, so I think that clearly we're all looking at domestic, source of funding, and that is more sustainable. And that's why I continue to emphasize on the fact that if we want to domestically look for funding, we definitely would have to look at earmarking of, these unhealthy commodities, through the taxes that we collect from them. It can even go beyond that, the extractive industry, the taxes they pay, and then alongside even the plastics, because currently government is also taxing the, plastics. So where are these funds going to? So we can collectively, put together all these funds and then earmark them to ensure that we are able to have some sustainable kind of funding, and I think this will go a long way. And it's going to be a long-term, source of funding for the MahamaCare or Ghana Medical Trust Fund. And then also, I think that we also need a broader, consultation or discussion on this subject matter. I also thought that there was that kind of, hastiness, in moving the process, and that's why, you could hear, people, though people love the initiative, we embrace it, you could hear that many more people also think that probably government should have done more consultation.
The understanding I have is that this is in phases, and there are going to be even other legislative instruments. The Member of Parliament is here as the program goes on.
Yes. So, in fact, so it's clear. It's there in the MahamaCare bill. I don't know why it has not been passed yet. The president have not signed. Onto it.
It was passed last week.
Yeah, but of course. The president is in a hurry, so we thought that by now it should have been passed into a law. But the point for me is, the guidelines. Yes, indeed, we agree that there's going to be some legislative instrument to back it. But see, there was some kind of hastiness in moving this one forward.
And if you could wrap it up for me.
We want to believe that, going forward, government will broaden the stakeholdership and then a consultation engagement, just so we can have a lot more people contributing and then making their voice known, to government as we continue to, to elevate the issues, beyond, just the Ministry of Health sector, but also make sure the other panelists who are also here. Indeed, you could see that because they do not have access to the bill, even as of yet.
I'll come back to you very quickly, hopefully, for your final word. I'm coming to Dr. Tinkranchum. And before I ask you the question, there's Felix Braco, who says, great submission, thumbs up, Dr. Tinkran. I want to ask you, I know that earlier you talked about at least 1% of money from gold going to the MahamaCare. You also mentioned the fact that you're monitoring how monies collected will be managed as well. Beyond these, what else do you have to say regarding the way forward to make this sustainable and make our health system, the overall health system, a better one for all of us?
All right, thank you. As I alluded earlier on, I think that the intervention from His Excellency, the President, Mr. Mahama, is laudable. What we need to ensure is that we need to put in a very succinct organizational structure, and also, as I indicated, have a dedicated funding source, and additionally, put in some cost containment measures or initiatives which will attempt to prevent anybody siphoning the little resources that we'll be able to gather. I believe that if you're able to put in place these three thematic areas that I have enumerated, it will go a long way to help in the sustainability of the initiative. And as I've said, it's a brilliant initiative. I want to encourage all Ghanaians to embrace it wholeheartedly, devoid of politics, and see how best we can reposition the health finance model in Ghana.
And I want to get your final words in about 30 seconds, Dr. Sandari, about really moving forward. There's already somebody here who says that he's proud of your submissions, and I believe a member of your constituency. Moving forward, really, what do you anticipate? What should we expect beyond what you've said?
Yeah, thank you very much. Moving forward, we should all support His Excellency John Dramani Mahama's initiative. We should all take measures to support, the fund. And I take the opportunity to appeal to all Ghanaians, corporate bodies, everybody that can contribute to this fund, you do, because your contribution may come to save you tomorrow. All of us speaking and contributing, you never can tell, tomorrow you might be suffering from a chronic disease, diabetes, hypertension, or whatever, and this fund would save your life. As for the sustainability measures, the Act, if you read it, has, measures to ensure that the managers of the fund would be people of repute that would not, misappropriate or misuse the fund. And therefore, it's a fund that has come to stay. Let's all contribute to its sustainability And we say thank you, His Excellency John Dramani Mahama. We thank the Minister for health and all those who have contributed, to see to the passage of this bill.
We'll have to end it here with you. Unfortunately, Dr. Sebastian Sandari, Vice Chair, Parliament Health Committee. Thank you very much for joining us on Agenda. Also, Mr. Labra Musa, National Coordinator of the Ghana Non-Communicable Diseases Alliance. Thank you as well for joining us on Agenda tonight. Of course, we've had our video call with us, Dr. David Tinkwanchum, General Secretary of the Ghana Registered Nurses and Midwives Association, as well as Dr. Evan Sutieku, Health Economist, University of Ghana. Gentlemen, thank you so much for joining us on Agenda tonight. My name is Beatrice. Do join us again next week. Coming up shortly is Ghana Tonight. Stay with us.